Being a mom of 3 daughters, I wanted to chart a different path than my grandma who died of ovarian cancer, or my aunt who died of ovarian cancer, my mom who had to be brave and go through chemo and radiation to treat breast cancer. I wanted to take control of my health and show them what it's like to make the brave choice of getting a prophylactic mastectomy, and to show that you can have a busy life and show that you can have a full-time job and yet take control of your health. And that's what I did. I'm Shannon Ingram. I had a wonderful team of doctors at MedStar Georgetown University Hospital. They helped me make a wonderful choice for my breast surgery. I have a BRCA mutation, the BRCA1 mutation, and that puts me at a very high risk for developing breast and ovarian cancer, to the point where it was very weighty on me for many years. And I needed to address that because it was becoming something that was taking over my thoughts.
So patients like Shannon who had a BRCA1 mutation should consider prophylactic mastectomy for certain reasons. So obviously their lifetime risk of having breast cancer is significantly elevated. Not only breast cancer, but they have other risks like ovarian cancer, pancreatic cancer, melanoma. So when I see patients who are BRCA mutation carriers, or even high-risk patients who come to my office, we counsel them. So right now the NCCN guidelines are that we can recommend patients who are increased lifetime risk of breast cancer with high-risk screening. So mammograms, MRI every year, and a clinical breast exam. Now, the second layer of recommendations is that patients could undergo estrogen blockade. The estrogen blockade are medications like tamoxifen that they take daily for 3 years to decrease their lifetime risk of breast cancer by 50%. And then there are women that have the option of prophylactic mastectomy.
One of the most important things to me was not only taking care of my long-term health and doing something preventative, but what was going to happen afterwards. I wanted to maintain a little bit of myself, but I wanted to make sure that my recovery was short and it wasn't something I was going to have to think about long-term.
When we do a mastectomy for patients who are BRCA mutation, or any patient actually, we remove 98% of breast tissue. So the benefit of having a mastectomy for a high-risk carrier is that we reduce their lifetime risk by 90% when we remove 98% of their breast tissue.
We came up with a good solution of doing a bilateral mastectomy with nipple sparing as well as resensation.
In her case, we were able to find a special type of reconstruction that is not commonly performed. It's called the Goldilocks procedure, where you use her own skin to create a breast mound. It was very important for her not to have a major operation, which is commonly done when you use your own tissue. And it was also important for her not to have implants. So we really worked with all the options and found her a personalized approach.
Dr. Fan is one of the few surgeons that is able to reconstruct your nerves so that in 6 months to a year you may start developing feeling again. And so that's profound, having that ability to have sensation. When you have children, when you have a husband, you have your pets and they come and they give you a hug, not to remember what it's like to feel that hug or caress, but to know what it's like. And so that was really important to me. And that gave me a sense of self. And that's something that the doctors at MedStar Georgetown do. They not only think about your health, they think about yourself. And how is that story going to unfold after the surgery? It's something that they are dedicated to, and I don't know that it's something that you find at a lot of other places.